I'm Dr. Wayne Jonas, practicing physician and executive director of the Integrative Health Programs at the Samueli Foundation and author of the book, How Healing Works. The COVID-19 pandemic has tested the resiliency of our patients, of our healthcare workforce, and the system itself. We now have the opportunity to make our healthcare better, to reframe and rebuild what healthcare should be, what we want. We want a system that not just treats illness, but also prevents it through whole person care. We want not just to bounce back after the pandemic, but we want to bounce forward and improve. Here are 5 things we need to do to improve the U.S. healthcare system in light of the pandemic. First is to understand patients' changing healthcare needs. Providers should be prepared for a shift in patients' healthcare goals as a result of the pandemic. More than 100 million Americans are already practicing evidence-based, non-drug modalities such as yoga, massage, acupuncture, nutrition, exercise, mindfulness, and biofeedback. Additionally, a June 2020 survey by Samueli Foundation and the Harris Poll found that 80% of U.S. adults stated they would be more mindful about practicing self-care regularly once the pandemic was over. Let's support them in these practices, have conversations with patients, and consider the patient's goals and help empower them to thrive. Providers should also be ready to integrate all forms of medicine, including proven non-pharmacological treatments like yoga, meditation, acupuncture, and various mind-body practices, along with the best evidence-based pills and procedures. Doing so helps give patients power in their care and can facilitate their own healing processes. Many of these approaches to care can help in unexpected ways. For instance, one patient with asthma had a persistent cough after COVID-19. Once she began regular postures again, yoga postures, designed to help breathing, the cough improved. Downward facing dog and child's pose were especially helpful for her, and both are examples of prone breathing positions shown to help with COVID. This is just one example of how non-pharmacological approaches to care can provide easy ways to help the patient feel better. We need to also change the health system financing and make it easier for physicians and their teams to bill for person-centered care. Patient visits to primary care physicians account for 35% of all medical care, and yet receive only 5% of the expenditures. On the flip side, only 3% of medical care happens in the hospital, but it accounts for a whopping 26% of expenditures. We're paying 5 times as much to correct problems that could potentially be prevented or reversed. An updated approach would include and pay for interdisciplinary medical teams that includes doctors, nurses, health coaches, behavioral and mental health specialists, nutritionists, and others trained to educate, empower, and support patients, and to develop and maintain healthy habits that prevent disease in the first place. Patients would be more proactive, engaged in their healthcare with this kind of a system and payment. We should also use this as an opportunity to reimagine primary care. COVID-19 zeroed in on attacking those with chronic and yet preventable diseases such as obesity, diabetes, and hypertension. These were the folks that ended up in the ICU and dying disproportionately. It highlighted the need to focus on chronic disease management and prevention. This can be done by investing in whole person primary care. If we do this, we can improve overall health while decreasing healthcare spending and preventing recurring issues and complications, both from chronic diseases and the interactions of COVID-19 virus with those with chronic diseases. And finally, we need to address provider burnout. The relentless demands of the modern healthcare system have left many physicians feeling frustrated and overworked. We know that burnout is associated with higher rates of unsafe care, unprofessional behavior, and low patient satisfaction. This was already an issue before COVID-19, and then it was greatly exacerbated by it. Many providers started quitting medicine. To address this, we need to get healing and heal the healer back into the heart of medicine. If we change the fundamental dialogue with patients so that the clinical encounter becomes person-centered rather than disease-centered, and we spend more time on what matters to the patient and care for the whole person, for prevention and reversal of chronic disease, we can get back to the very reason we became physicians in the first place. Let's change that dialogue. Let's change our practices. Let's change the system of care. Thank you.